Hi, good evening, everyone, and welcome to 30 Minutes with Health Parliament. I'll give you a genesis of this idea of how it started. All through my working, I have gained most from conversations. And what a time for us. We cannot worry about going to one place and meeting. We can be anywhere we get connected and talk on issues that matter. And I can bet you, this series of 30 Minutes with Health Parliament will be thought provoking for you. We'll provide you with opportunities to share ideas. Also get, I would say, position yourself as a thought leader. You will find that in these conversations when someone says something, it provokes you to say something maybe contradictory or complementary. You will come out with fantastic ideas, which were not there before you got into the conversation. So I think this could be opposing viewpoints as you may not agree, but you may propose something which is very interesting, very important for healthcare. And I think this is the start of a great journey for all those who think that they have ideas to share. This is the platform for you. We created this Health Parliament platform, 30 Minutes with Health Parliament. My colleague, Dr. Manpreet Kaur, who is Project Director, Health Parliament, will lead this. Manpreet, over to you.
Thank you so much. Thank you all for joining 30 Minutes with Health Parliament. So I'll start with giving you a brief overview of Health Parliament mobile app and what all you can do under the mobile app. So I'll share my screen. So Health Parliament's motto, vision and mission is real work, great leaders and right policies. And whatever we are doing, the projects, the public health campaigns and the initiatives, we work with this mission to do real work, build great leaders and having right policies. So our global footprint is all across the world. We work with World Health Organization, United Nations, SFMI, and also we are part of Government Blockchain Association, Commonwealth, and we were India partners for Global Digital Health Monitor. Health Parliament mobile app is available now in India and 67 other countries. So like you all are the members of Health Parliament and be it professional or professional plus. So we have professional discussion forum dedicated to a specific topic. You can join these forums, you can follow these forums and you will receive regular updates on what's happening under, for example, digital health, nursing, pharmacists, global health, public health. And also you can start a discussion, put your viewpoint and raise your voice there, maybe discuss your idea with the fellow community members. And also we have a blog section, article section where you can like request and send us an article. And after going through rigorous editorial process, if it's selected, we will get it published on Health Parliament mobile app. Also, on the event section, you will see that we regularly update various kind of events which is happening under Health Parliament and sister SPUs, be it International Patients Union, Global Digital Health Summit, or Academy of Digital Health Sciences. And these events give you an exposure to like senior leaders and also their work, and you can register and discuss with them your ideas. We also have a resource section where we regularly update the reports published by Health Parliament and also published by various multilateral organizations. This gives you a comprehensive view what's happening in the healthcare sector, and it gives you information for your research. Maybe if you're doing your PhD, it will give you an edge in comparison to your maybe batchmates or peers to go ahead. So it's freely available there. You can go and download it in mobile on your laptop, or you can view and read it in your mobile app. Also, you can for every activity which you do on Health Parliament, you gain points. Be it you are commenting under a discussion, you are requesting for a discussion to start, or a professional discussion forum, or you're writing an article. So for at every step you gain some points, and you can basis on these points you can become a contributor, you can become an opinion maker, thought leader, or an influencer in the healthcare sector. And also you'll see that you must be getting regular news updates from Health Parliament. So our motto is to keep you updated. So like just spending 5 minutes, even less than 5 minutes a day, keeps you informed about what has happened in the healthcare sector globally. So you can see that these are the levels of becoming an influencer in the healthcare sector. So as I have told you that for every activity you gain some points, and you start with the contributor level 1, then 2, then 3, and then 4, and then you after that you can become an opinion maker, and engaging more and more pushes you to the higher level thought leader influencer. So you lead by doing in Health Parliament. These are the the reports that we have published under Health Parliament. These are the the series, discovery series, knowledge series, and the leadership series. We have also conducted written a paper, Asia position paper on universal health coverage by in collaboration with Global Call to Action Against Poverty, People's Vaccine Alliance, PVA, and Asia. And also we have done a status paper on One Health in collaboration with the Brook India. So these knowledge bank you can download for free from Health Parliament. So these are the more of the reports we have. We have done our analysis on healthcare budget 2025, implications of DPTP rules 2025 on healthcare, preparing clinicians for digital era, and prioritizing women's health. Also, we have brought to you this series, Health Parliament Innovation Lab series. So, we have conducted 9 episodes with the top healthcare leaders like Dr. Abhay Bang, Dr. Surya Bali, and these are the lead men of India, Dr. Venkatesh Thuppil, sir, and also Dr. B.S. Garg, who is the person behind, he's the secretary there, Mahatma Gandhi Rural Medical College. It's the first rural medical college of India. So I'm aware that many of you join regularly this Health Parliament Innovation Lab, and I hope you must have learned, and you must be implementing a few of these key takeaways that you learned from these Health Parliament Innovation Lab episodes. So I request you all, after our discussion here, you go to Health Parliament app and start contributing. Thank you.
What's the format of this discussion that you want to give them an idea about the format of the 30 minutes with Health Parliament?
Yes. So for today's discussion, we have posed a question, what's the biggest challenge in the healthcare today? And I request all the members to come forward and speak on this issue. So you can go and raise your hand, and we will allow you to speak. And I'll request you to, if you when you speak, to give a brief about yourself, maybe your work profile, and then you have 2 to 3 minutes to speak about this issue. So
and
you can.
Are we also giving out some?
Yes, sir. We are giving them reward. So we will be sending them the top idea of today. Will be receiving a healthcare book as a reward, and a shout out on our social media channels.
Yeah, and this is your time not to hold things to yourself. This is your platform. Speak out. You never know which idea gets clicked. That's how I became a policymaker, by talking to people and saying, why don't you do this? I say, come and meet me. So this is something that are we broadcasting over Health Parliament?
Yes.
So almost 28,000 people are on Health Parliament LinkedIn page, is getting live broadcasted there. So this is an opportunity for you to reach out to masses, to show the leader you are. So it's your platform. Please use it, and just go ahead and share. Just raise your hand, and you will be, brought in to speak.
Hi.
Yes, good evening, doctor.
Yes,
Yes.
Dr. Ramesh. Please
Yes.
go ahead.
I'm audible.
Yes,
Okay.
you're audible.
Thank you so much. This is a really wonderful section where we can share not only thoughts and major issues. Currently, if you see in our India, the health data will be the crucial for any doctors or for any treatment. Suppose if any patient unconsciously falls somewhere, if you want to know what happened to him, nobody is there around him. So exact what type of blood group he's having, what type of previous problem he's having it. To extract everything, this case examination taking to emergency department will take a lot of time. So instead of those things, if you enable anyone facility uh, basic information, with that one, we can extract information somewhere like Ahmedabad or somewhere. So the treatment will be very fast. They will not delay any further examination for the future environment. And also for future any health products to purchase also, the data will be available for the insurance companies to give which type of products to the customers.
Thank you, Dr. Ramesh. This is a very valid point, and I think data is an issue currently in the healthcare sector. So next is Girish Daga sir. So please allow Girish Daga sir to speak.
Hello.
Yeah, so please go ahead, sir.
Yes, good afternoon to sir and to you also. The question, the main issue, what I am from Ayurvedic background. I have my own Ayurvedic practice, and which nowadays I am seeing that EHR, electronic health record, is government is collecting this record in a very large scale and in a different district. But if you go through the format of that electronic health record, it doesn't have any option to record the patient's health regarding the holistic medicine science. So I will suggest that this electronic record should be integrated electronic health record. It should not be only EHR, it should be IEHR, integrated electronic health record. The major benefit, if we think, we can see that almost 80% of our health situation in our country is maintained through our holistic health only. Only 20% are people are going to the hospitals and different health centers. So if we not collect this holistic health record, this Ayurveda system will day by day it will be collapsed. There will be no proper record of the Ayurvedic treatment. So to maintain such treatment, I think the EHR should be IEHR. Holistic patient care will be recorded in that. It will be evidence based. The allopathic or the modern people can also see whether that patient has taken Ayurvedic treatment and what's the benefit he got from that treatment. So both in both way, Ayurvedic person will also can see that how he is taking medicine from the allopathic medical science and how he is getting benefit. So I think the EHR should be the IEHR, and our health parliament should raise this issue, because I think in digital health community, our digital health parliament plays a major and vital role in our country. Thank you.
Thank you so much, sir, for raising the issue on the behalf of Ayush community. And I think this is a very valid point to integrate Ayush system into our electronic health records, because particularly in India, this is our majority of population at some point of time has taken an Ayush treatment. So if it's available in data records, we would be able to streamline the whole treatment process. Thank you so much, sir. Next is Tabrez Manner. Please allow Mr. Tabrez to speak.
Hello, am I audible?
Yeah, please go ahead, sir.
Hi, Dr. Manpreet. Thank you so much for this opportunity. My name is Tabriz. I'm a digital healthcare consultant, turned as I would say, co-founder. I have worked across multiple hospital operations, revenue cycle, digital health, from the product as well as from the consulting side. And just to come to the point, the biggest problem which we have seen is the data with the kind of technology that we have is been pretty abundant, right? So everybody has the access to the data, but we haven't actually put in more focus. Though this data is at a very abundant level, is it really understandable for a patient to kind of consume it? Are they really well prepared to, or do they have a contextual understanding about what has happened to them through their medical reports? Currently, the kind of situation there in India, and the kind of burnout rate which our dear doctor community is facing, they do not have that much of time and liberty to kind of explain it to the patient in terms of what has happened to them with their clinical reports. Though people like who have some understanding about technology, they end up doing a Google or a Chat GPT in today's world, but they do not get a very contextual information in terms of what has happened to them, and they end up getting to undesired, uncontextual reports, which either lead to cancer, or it either leads to let you know how many years you have left to live the life. And that's where we are trying to solve this very neglected though very common issue by building a proprietary LLM, and we are making it very simplified for patient to understand uh, what has happened to them through their reports itself. So whether it's there gonna be radiology reports, pathology reports, genomics report, and any other report for that sake, even their discharge summaries for that sake. And if they really want to know what has happened to them, uh, a non-clinical person also can able to just see through, and he will able to get information along with attempt that we have made through. Um, and I hope ultimately we will empower patient to know what their actual reports entails or rather inform them about, and that's the uh, innovation that we do.
Thank you, Mr. Tabrez, for highlighting again the data issue. You should check one of our initiative, Data First, AI Later. So the idea behind starting this initiative, this was ideated by Dr. Rajendra Pratap Gupta. So the idea behind, because since we are talking about artificial intelligence, machine learning, big data, and all other things, but nobody is talking about data. So whole premises of constructing these technologies, foundation of these technologies is data. And if we do not have good data, if we do not have integrity and the correct data, we will be failing these models. And the whole healthcare system, and we're talking about digital health, the whole healthcare system in the future will build on the decisions made by these machines. So if if we are not feeding in the right food, so what's coming out will be hampering the health, our health. So it's time that we should talk talking about this data. So next is, thank you, Mr. Tabre. So thank you. Next is Tamil Selvan sir. Please, sir.
Hello, am I audible?
Yes, sir. Yes, sir. You're audible, sir.
Uh, Actually, I would say, almost feel like repeating what the other says, but in other different terms, um, health equity and transparent healthcare is a big problems in the. If you address these two problems, I think make the healthcare transparent. Then it will also address the health equity, because when we talk about the health equity, right, people always talk about socioeconomic differences and those lines, but take insurance is refusing insurance companies refusing for the aged people or pre-existing conditions, so they are putting under higher cost than their peers. This is a universal problem. So things, the second things, because once you bought the insurance also, right, the claiming process and the hospital, because it's a bit complicated with the provider and everybody is putting stress to everybody. So things, so how we can make it transparent, because we do have everybody talk about data. The data should have, the patient has a existing condition or has some diseases, they should know what is the options available to them. Whether it's, whether it's Ayurvedic, allopathic, whatever the system we have, Siddha, Unani, we have plenty of systems. So they should know, okay, we should have a data. The data should show, okay, if I'm going the path, these two, I will get these results. If I'm, for example, I will combine Siddha and allopathic, I will get these kind of results, because we have enough data to analyze it in Indian traditional medicine everywhere. I think I hear India has almost submitted traditional medicines, those data to the WHO as a first country, if my knowledge is not wrong. So we should have this kind of data. We should combine so that make it more practical. Then the cost. You should, because the AI, remote monitoring, everything is going to happen. You see, the aged people, we can do them in the home. They not necessarily need to come. People call them the poor. So we should give them option. As in a rehab, I mean, just working in the rehab. For example, your stroke patients, India, there's a plenty of people now. There's plenty of acute hospitals, which is covering the acute care. After the acute care, all the insurance money is sucked out. When it comes for rehab, nothing. Say, what's going to happen? Are they going to be bedridden forever? But I remember I work in Maharashtra. At the time, there is a poor, I mean, I work for a medical college. I should not say the term. They are not offered to go to those kind of hospitals, that they just come to me. At the time, I was very student level. I just pass the information. Just do like that. Just do like that. You put the weight bear on the hands will improve. The wife was so dedicated, doing for him. He is showing the improvements. What all the things is the knowledge is passed to them. They are doing, at least when we are talking about health equity, we just transfer the knowledge. We no need to provide a medical care to these people. Transfer the knowledge. That will do. This is what I'm thinking. So that health equity and transparent health care is bit related. That's a big problem. We make the healthcare transparent with the data and everything. Provide to the people who can need it, who cannot afford the treatment economically. You should give them alternate source. Treat them at the home. Bring the healthcare to the home. Give the knowledge. This is what I see. It's a big problem in the. This is what I see. Yeah.
Yes, so you correctly said, because the knowledge is power, and to empower the patient, we should provide them with choices and the knowledge, as you have mentioned. Thank you so much, sir. Next is Dr. Shelly Mittal. Please allow Dr. Shelly Mittal to speak. Yes.
Hello.
Yeah. Hi,
Yeah,
Dr. Shelly.
yeah. Hello. Good evening. Thank you so much, Dr. Manpreet and Dr. Rajendra Prasad Gupta. Thank you for this platform. As per my view, the biggest problem in the India's healthcare sector, we know that India's healthcare system suffers from a plenty of challenges like resource constraints or the accessibility, affordability, then lack of awareness that are there. They have been there since the beginning, but then India's healthcare system challenge that I actually want to highlight is that the fundamental fragmentation in the India's healthcare ecosystem across the sectors, across the stakeholders, across ministries, across disciplines, and within the level of education also. For example, if a student at the school level, especially in India, is taught about human biology in isolation. If he or she catches flu, he might not be able to understand that it might have come from a bird or a pig. It may be an avian influenza or a swine flu. Then later on, when a veterinarian comes into a college at the graduation level, he studies about brucellosis, about TB or anthrax, but he may not be able to collaborate with his human medicine or human pathology or human microbiology counterpart. He may not be able to interconnect these diseases, which are the zoonotic diseases. He may not be able to interconnect or the collaborate with the human counterpart. And the same student, when goes into the master's degree, for example, if he has to undertake, he chooses veterinary public health. For example, he is in the veterinary public health department, and he in the synopsis he takes the topic of, for example, mapping of bovine TB. Then he for his research work he may not be able to understand that he can go to a civil hospital. He may collect data on human TB patients, and then he can collect data whether these human TB patients, they have livestock at home, and this kind of disease transmission may happen from the livestock to the human beings. These kind of interconnections, they can be embedded at the very early at the school level. So in the school level curricula also, right from the school level, for example, 8th, 9th, 10th in the NCERT curriculum, the One Health concept should be introduced. The health should interconnections of the health, they should be introduced. Then in the veterinary as well as MBBS as well as environmental sciences or the other sciences also, Ayush and Urani, they should be One Health concept should be introduced in their veterinary all these sciences curricula. And the interconnections, there should be a separate course. There can be the interprofessional courses also in all the sciences. There can be the capsule interprofessional courses, and there can be the we can say that co-guidance from cross-sectoral faculties. For example, TB research can be guided by both a veterinarian or the pulmonologist, like that. So, because the fragmentation leads to a kind of lack of efficiency, duplicacy of efforts, and poor disease surveillance. So ultimately, the healthcare system, what should be the healthcare outcome should be there, that is not up to the mark. So my idea is that. So we should.
Thank you, yes. Thank you, Dr. Shelley, because problem is, the challenge is that we work in silos. We, like, as you have mentioned, the fragmentation of healthcare system. It is at every level, be it primary care, be it secondary care, at governance level. Everyone is working in their own chambers, and nobody is speaking with each other, and nobody is collaborating effectively with each other. And I know you come from One Health background, and you are very passionate about One Health. So I think this is a very good idea to include One Health concept at the school level when the formative years. So through the curriculum development, and we can teach them that it's a part of life, and we are living in the world where everything is interconnected, and we can formulate their viewpoint about health from the very start. Thank you, Dr. Shelley, for such a brilliant idea. Next is Nityanandam sir. Please allow Nityanandam sir to speak. Sir, please go ahead, sir. Sir, we cannot hear you. Hello. So your voice is not coming through. So in the meantime, we will allow Yogesh Chandra sir to speak.
Right.
Yeah. Okay. I guess. Sir, you are on mute, sir.
Now, okay?
Yes, sir. We can.
Good evening. I'm Dr. Nityanandam.
Yes.
So, I'm happy to hear what everyone is talking about. But my concern is, are we having an unified ID to everyone? You need data, but data will be, it is available, but it is not to a particular person. See, everyone should have a unique ID. Then only those data can be stored. How are you going to achieve that? How are you going to implement that? Each and every state, because of political issues, they are not allowing to use the unified ID. Unless every individual like Aadhaar have an ID, then only we can implement, we can store the data. Or else data will be my hospital will be different, your hospital will be different. Everyone should have an unified ID like an Aadhaar. 6002025 means it is Nityanandam's. If I write in my hospital, it will be there. If I go to Lucknow, if I record in that government hospital, they should record in that ID. Then only it will be transferable. Or else data will be shared. It will be there, kept in each pockets. It will not be able to, make a meaningful sentence. Even in my own hospital, for example, a person He gets an OP ticket today. Tomorrow he gets one more OP ticket. He comes as a new patient. How am I going to address? So unless we have the power or determination, we have a clear-cut guidelines throughout the country. These are the things like your ration card, like your Aadhaar card. Everyone should have an unified ID. When they go to any hospital, for example, we'll implement in the government hospital first. If they go to hospitals, that ID should be there. That unified ID should be there. Every time, how you can check how many times he has come. Without that, the person registering each and every time, you cannot make any meaningful sentence. And moreover, the government, though you are qualified in with digital health, IIM, or you have an MBA qualification, NMC also doesn't recognize these degrees. How are we going to address the people who study these course, even MBA and IIM and digital health? But are they utilizing our service? They are not utilizing our service. Our names are not being brought to the particular state government to utilize our service. After taking charge of the HOD of a new hospital, they asked me how many Parkinson disease you are seeing, how many stroke you are seeing. They want to buy medication. I don't have any data. Roughly, I calculated in a day how many stroke I have seen into 28 number of working days. I calculated and gave. Even my whole hospital. So I'm trying to reorganize, make my own data, make my own number, and enter those patients who come for stroke, how many times they have come. I'm trying to do that. So we are finding it difficult unless we have knowledge. The knowledge are not being utilized for unknown reason, and we don't have an unified ID. Only when you have an unified ID, we can get meaningful data, and the data can be transferred to other state or other place. Without that, we can't do that.
Thank you so
This
much,
is
sir.
my opinion.
Yeah, thank you so much, sir. Like from this conversation only, I can see that no, everything like the healthcare system is connected, interconnected, but yet we are operating in silos. So you have mentioned about the knowledge, you have mentioned about the data. So and also the interoperability of the system. So the previous speakers have also highlighted the same issues. Somebody has mentioned about the knowledge is power and fragmented healthcare system. So I think as a community, we can work together and keep highlighting these issues, keep working on these issues so that we can make this healthcare system of India, the system we have dreamt about for so long. So next is Yogesh Chandra sir. Please allow Yogesh Chandra sir to speak. So please go ahead, sir. Sir, can you hear us?
Okay, good evening, Dr. Banpreet Kaur and Dr. Rajendra Gupta, sir. Actually, I am a medical graduate with the MBA Hospital Administration, MPH, and the PhD also, and I was assessor also. So, whatever the views I am going to present at this platform, that may be the whatever I have experienced in all these areas. The biggest point, which is the greatest challenge in the healthcare, is not only the scarcity. It is basically we are sometimes we are failed to deliver the things which what we have. Recently, one incident is happens in the Odisha just because of lack of one ORS packet. One child he expired. So we can understand that there is nothing like there is a high level of the scarcity. It is one thing which we are actually what we have, we are not able to deliver it also. And second point, I think that is the equity versus innovation. If we talk inequity is the biggest problem in the healthcare in India also as well as the globally also. If we are innovating the ideas, we are innovating the policies, we are innovating the various technologies, but it is not reaching to everybody in the country itself or in the global. We take the example of this COVID vaccine also. Even after after the 8th month or the 10th month of this COVID vaccine, only that then African countries they were able to get this vaccine. Second, I think most of the time we are designing our system for the profit, not for the people. Most of the time, if we see this preventive care is a very good concept. if we focus on the preventive care, a lot of health expenditure can be reduced, out of pocket expenditure or all sorts of expenditure which are being paid by these insurance companies, that can be reduced. So our system is just they designed for the profit, not for the people. And if you take the example of this mental health, because we are not getting very much revenue on this mental health, most of the hospital they are ignoring this part of the mental health, while it has very significant role in all kind of diseases and all kind of output also. So in my opinion, there are some symptoms of system also. We already, if we are suffering from some kind of disease, we produce some system. But if you talk about what is the present system is there, they are also generating some kind of symptoms. If you take the example food system, and as everybody has talked about that, we are working in the silo. So if we talk about food system, we ourselves we are promoting the junk food and all that kind of things. And again, we are going for definitely we are going to develop some kind of disease or some kind of symptom, and we go to the doctor. Same thing it happens. Most of the facilities they are available into the urban population. Whether you talk about the even the district hospital in the public health concept, or various bigger hospital, corporate hospital in the private sector, most of them they are localized into the urban areas. So that difference also make the difficulty in the accessibility. And the third point is that healthcare system, they most of the time they reward the treatment. They are not rewarding the preventive care. That is a very big challenge which I have seen during my NCLAS assessment. We are not much more focusing on the, we have to we should focus on this preventive care, which is actually prominent in the public health. But when we talk about the corporate, they are just working for their profit. System is designed for the profit. And the third point, which already everybody has discussed, we are working in a silo. Suppose one patient he comes to me for the anemia, so I just ask you, ठीक है कितने दिन से problem है, how much is your report, we advise some kind of investigations and all that kind of things. But we never entered in a detail which background he is coming or she is coming from, what is the mode of the earning, what is all that kind of thing. So if we start taking all this kind of information into the health record or electronic health record, whatever it may be there, we find we cannot treat the anemia only with giving by IFA. We have to see the other part, whether he is able to take the nutrition, whether he is able to afford the nutrition, whether there's a particular nutrition is available in his area. That is one also big thing. And last one I want to say, there is a some lack of health research also. A lot of people they are doing the health research. I am talking about the health research. I am not talking about the medical research. A lot of people they are involved with the health research, and they have very beautiful ideas and that can create some very good policy to address the lot of issues. But somehow people are not there. As if you talk in the India also, we are not expending so much amount on the health research and all that. So that is one thing. If we start promoting this health research and all that, and few basic courses, data engineering, that is a very basic kind of code. Data is a big challenge. We are not able to produce data which can be easily read. Then it becomes very difficult for any kind of artificial intelligence and machine learning to provide some kind of good output. So that at least basic data engineering we are supposed to teach various students at the MHA level, at the MPH level, at the MBBS level, all that kind of things. So my takeout is that if we take all these issues, whatever I have told, and we can do something, so definitely we can add some value in the our present public health system also, and we can take care of our citizens, and we can reduce the out of pocket expenditure, which is the biggest headache in the India. Still, it is more than the 50 and the 60%. Thank you, ma'am.
Thank you so much, sir. I think you have nailed it. The focus on preventive health, the burden of non-communicable disease we are facing presently. Because, like, I'll give you an example. So, our office admin, who is very young, he's in early 20s. He's suffering from hypertension. So he's also on regular medication, but it's not working. So the challenge we are facing with the especially in the youth, will actually not even like not only hamper the economic growth of India, but also it will burden us in the future when it comes to like taking care of the disabled, the deceased individuals in our family. Thank you so much, sir, for the putting your points. Next is Siddharth Kalot. Please allow Siddharth to speak.
Hi, good evening, Dr. Manpreet. Can you hear me?
Yes, I can hear you, Siddharth.
Thank you so much, I
Please.
think, for this wonderful opportunity. And I think, first of all, I think thanks to all the speakers. I think they've highlighted some great points. And I pretty much am essentially just going to give a recap of what they sort of said. So, in my opinion, I feel the biggest problem, I think, what the healthcare system, I think, that India faces predominantly is the fact that healthcare is largely reactive. It's not proactive or preventive, right? We have seen like we seek sort of healthcare providers only when sort of symptoms set in, right? Often when they become too late, and knowing very well that the symptoms are associated with the lifestyle diseases, right? And these lifestyle diseases are chronically built over time, right? Knowing very like you mentioned the NCD burden, where you have 65% contributing uh, largely from sort of cardiovascular diseases, diabetes, hypertension. We are essentially going to healthcare providers when we have manifested with these symptoms over years or months. So essentially, the model that sort of the hospitals are working with, they're essentially working with a curative model. Their basic sort of duty is to ensure like the normal functioning of the body, right? So their duty is essentially going to get the symptoms back to normal, right? That's the duty. It's not they're not getting rid of the underlying cause, right? That essentially is going to be driven by your lifestyle changes, and no one sort of sadly the healthcare system doesn't sort of promote preventive healthcare, which will tackle these sort of so-called underlying causes through lifestyle changes. They're essentially rewarding sickness, right? Which I think another speaker highlighted. We're not rewarding health, and it's become a big business. I think sadly, you take pharma companies, take private hospitals or insurance companies, they all profit when people are sick, right? They're not going to make any money if people are well, because there is no money in a healthy patient, right? So sadly, they want people to sort of continue living this sort of reactive mindset for deal with this sort of lifestyle disease and come to our hospitals. Will over treat you, will over diagnose you, and because you are not empowered, that sort of contributes to the poor sort of patient empowerment as well. Coming purely down to the fact of health literacy, I think being so like so low, right? Now, when patients are not even aware of their own bodies, their risk factors, or even like the basic vitals, right, which are documented in the diagnostic reports, what does that lead to? You come at the mercy of healthcare providers who are essentially going to take advantage of you, and you essentially, as a patient who is going to healthcare provider for your own service, you want to be empowered. You want to be an active member in your own healthcare journey. And sadly, the healthcare providers don't give you that option. So this becomes, I think, a major issue. Health literacy, I think that needs to be targeted. Another one, I think a lot of speakers highlighted is the disjointed and the fragmented care. Like I think you can clearly see that. I think you go to a GP, you get labs done from a different diagnostic center, you get met from a different pharmacy, you're consulting a different specialist in a different hospital, and essentially you're having no communication between the things. It's completely siloed, right? So when the healthcare information is so siloed, you essentially will have you're not doing anything to improve your health outcomes, right? So that's why I think having uh, a coordinated network, I think has to be established, because otherwise it's just not going to improve. And I think this also, I think, adds to the fact that healthcare inequity, right? Especially when you see private sort of healthcare hospitals dominate healthcare in this country. So it's sad that money and awareness is essentially going to decide whether you live or die. So when 65% of this population residing in rural communities are essentially going to face the same sort of healthcare outcomes going forward, unless there is a surprising like consensus between the private and public players, this sort of the tragedy will sort of continue to go on. And that's down to the lack of, I think, the public-private partnerships. I think is driving this, right? The inequality. So I think that's it in a nutshell. I think unless these major sort of aspects are taken care of, I think you are going to deal with a fragmented, profit-driven healthcare system, which have no sort of intentions for the betterment of the society, which is sad. Because even when you look at most of the startups, I think they're more B2B driven as opposed to B2C. When your goal is to essentially improve the healthcare for the citizens, right? You're helping hospitals earn more money, right? You're essentially what providing solutions to improve data collecting, or like like have a seamless experience within your own hospital setting. What are you doing for the patient, right? So that's it. I think if you don't change it, they change this at the core, I think it's just going to continue. So I think it's a mindset shift. Mindset shift has to happen, and I don't think the public or the private players have the best interest for people. So it's just going to continue like that, which is very sad.
Thank you so much, Siddharth, for actually summing up the session for me. This is really taking away a lot of key points from this session. Be it our lack of focus on data, and the problem of interoperability we are facing in our country, and also the fragmentation of our healthcare system, lack of awareness towards our health, and the lack of focus on preventive health. So I am grateful for this vibrant community of Health Parliament, and thank you to you all for speaking your ideas out loud here, and we'll make sure that these ideas are converted into action. And we will be coming out with the one pager post this session, and we will be, once ready, we will be sending it to you through email. And of course, one top idea from this session will be getting a reward, a healthcare book, and we will be announcing it soon, and a special shout out on the social. So I think this vibrant community separate good sessions from great ones. And like my last ask to you is to don't leave your thoughts hanging in here. Log into the Health Parliament app, put your perspective there, and challenge others to build on it. Because the future of healthcare won't be written in